very diligently, I think, in Abu Dhabi for the past 4 years to assess the diabetes and cardiovascular burden and chronic disease burden, and more broadly disease burden overall. And we have been profoundly humbled by the data. We have a mountain to climb, but we've been working very hard to set the regulatory structures and create a really solid foundation for that climb. And we are very well aware, as the health authority, that we are a regulator, and we need to work with industry, health sector industry, and also non-health sector industry to tackle the problem. And in order to do that, we recognise that we need to help to develop for industry game-changing business models. So what I'd like to do is to say a little bit about how the health authority views that. The first topic to touch on is the stability of vision. Now, in the previous life, I've worked with private sector industries and also worked with investors, and I know that one thing that business thinks about is risk. One element of risk is regulatory risk, and has the Emirates of Abu Dhabi developed and stuck to the same strategy, vision, mission, and objectives for 5 years. That strategy is specific. It's woven through our website to the point of being a little boring, and it is not changing in the near future. And I just want to run through it very quickly. So in the Emirates of Abu Dhabi, everyone has access to healthcare, Emirati and non-Emirati, and the freedom to choose their provider, on the proviso that choosing your provider helps to increase quality. The system encompasses the full spectrum of health protecting, promoting, sustaining and restoring services across the Emirates. Quality is driven by ambitious improvement targets and through data transparency. Providers are independent and predominantly private. It's an open system for all certified providers to come, show what they've got. The financial system should be flexible in order to manage the change over time. So with universal health insurance, the health system finances itself through that insurance for Emirati and non-Emirati. That strategy is in place today, and it is the foundation stone for game-changing business ideas. Through the Wakaya program, we have screened the entire adult Emirati population, and we have the largest cohort of individuals who have been screened against the following number of factors. That's the good news. The bad news is the data. And we recognise that we have a tremendous burden of cardiovascular disease risk in a very young population. So 71% of Emirati adults over the age of 18 have at least one risk factor for cardiovascular disease, and intervention in a population which has an average age of 28 years needs to be meaningful, consistent, systematic, and because the population has many age ranges, many men and women, people living in urban and rural areas, we need to find a range of services to tackle the burden across the entire population. Based on the evidence of what's been done elsewhere, so for example North Korea, landmark programs in the US and UK, we set ourselves the ambitious target of a 75% reduction against predicted cardiovascular risk that will save, if we hit the targets, many thousands of Emirati lives. So Abu Dhabi has, we believe, a unique combination of circumstances. We are relatively small, we are relatively well resourced, we have exceptional health data, we have the stability in terms of strategy, and the targets that we've set ourselves in that context, working with industry, are rightly ambitious. So to save many thousands of Emirati lives and contribute to making Abu Dhabi one of the healthiest environments to live by 2030, moving steadily across multiple dimensions and multiple verticals to achieve that. And in so doing, really drive historic impact, which contributes to global health innovation, and to build opportunities for education, for research, and for academia in the Emirates. So in principle, we want to bring the best of the world to Abu Dhabi and find innovative ways to do that, to help tackle our problems, and in so doing, develop unique intellectual property know-how ways of doing things that we can in turn then look at exporting to other parts of the world. Now, there are a are needed to achieve that and pull it off. It is not a trivial task, but that's something that we're very serious-minded about doing. We recognise that there are aspects of a wellness program which combine health sector, so we're looking at clinical care standards, customer-centred clinical services, real innovation, how to make patients use those services through looking at compliance, and also looking at real research and innovation. I was very pleased today to sign 2 MOUs, one with AstraZeneca, one with Eli Lilly, looking at research and innovation to find new ways of tackling some of our burden. But we also need to look outside the healthcare sector at some of the health guardians, as we call them, some of the verticals that have a driving influence on the health of the population, so particularly nutrition, physical activity, tobacco, employers in schools, and urban planning. So this is breaking news, and will be what will unfold in the next 12 months here in the Emirates of Abu Dhabi. Now, we've had discussions with many of you, particularly DMP providers, who've been anxiously awaiting the publication of our DMP standard for the Emirates, so thank you for your patience. It's this issue and the innovation that's woven into this issue which is causing that delay. So, based on the unique circumstances we have in Abu Dhabi, we are proposing to look separately at what we call pay for quality, which is compliance with care standards. It's driven in an individual encounter between a physician and a patient. It is acting in accordance with those care standards and doing a great job in that session. And then looking separately at pay for health, where the unit of reference is none other than the health status of the individual as it changes over time. And the basis of value creation by the provider is the ability to improve the health status compared with baseline prediction. So the reimbursement for pay for health is itself something entirely new. We have proxies for it in global healthcare, and health insurance is a good model, but it is not truly paying for health. We have a health care system, but in a very real sense, we don't have a health system. A health care system which is involved with doctors, nurses, and reimbursement for activity, but which misses many of the gaps that Mark touched on in his presentation that happened when health is being driven between clinical episodes. So in a nutshell, paying for health is about paying for an improvement in the health status, working with a range of technologies, but also bearing some risk if the health status fails to improve or if the health status even gets worse. So just my final slide, specific opportunities within the Abu Dhabi market within the space include providing education on the HAD clinical care standards, helping us to develop excellent clinical care protocols, working to deliver innovative, customer-centred clinical services, moving away from the model of we've got our hospital, why don't the patients come to see us, to say no. So we recognise that people are living, making decisions in the community, at home, in their schools, in the shopping malls, in the supermarkets, in the restaurants across the Emirate, and we need to drive healthcare there. Also looking at at-home monitoring and remote diagnostics, and ensuring that becomes a major feature of the upcoming health system. And also then this innovative idea of how to deliver health, not healthcare, how to deliver health, and working out how to pay for that and how to deliver it. So that includes compliance, it includes reliably and in a tailored way, because one size will not fit all, helping individuals to change their lifestyles and modify their behaviours, and also looking at health guardian interventions to help shape the choices that people make in nutrition and physical activity, keep people away from smoking tobacco and help those who do smoke tobacco to quit, and helping to create the right environment in which to shape those decisions. So that's what I wanted to talk about. I look forward to the Q&A.